Bismillahirrahmanirrahim. Today we will discuss about the bone tumors. But before we discuss about the bone tumors, few words about the fractures of bone. A fracture is defined as loss of bone integrity resulting from mechanical injury or diminished bone strength. And fractures are of different types, like simple fracture is overlying skin is intact. Compound fracture is when there is involvement of the skin and bone communicates with the skin surface. Simple, compound, then comminuted, the bone is fragmented. Displaced fracture, ends of the bone at the fracture site are not aligned. That is displaced fracture. Stress fracture, slowly developing fracture that follows a period of increased physical activity in which the bone is subjected to repetitive loads. That is stress fracture. Green stick fracture, this extends only partially through the bone. It occurs commonly in infants when bones are soft. Green stick. And pathologic fracture. Pathologic fracture is a fracture of bone that is involved by other disease process like tumors or osteomyelitis or Paget's disease. So that is pathologic fracture. So let us come to the bone tumors. So bone tumors, they are classified on the basis of the normal cell or matrix they produce. So they may produce bone or cartilage or fibrous tissue. Then there are miscellaneous tumors of the bones, or the cell of origin is unknown, like Ewing's sarcoma, giant cell tumor. Then there are metastases to the bones. So we classify the primary tumors which involve the bones. So first is the hematopoietic tumors like multiple myeloma, malignant lymphoma, which involve the bones. They are malignant tumors. Then chondrogenic, they are 2% of the bone tumors. And here there are benign tumors and malignant tumors. So benign chondrogenic or cartilage forming tumors, they are osteochondroma, chondroma, chondroblastoma, and chondromyxoid fibroma. And malignant is chondrosarcoma, dedifferentiated chondrosarcoma, mesenchymal chondrosarcoma. Then osteogenic, that is bone forming tumors, 19%. Benign ones, they are osteoid osteoma and osteoblastoma. And malignant is osteosarcoma. Tumors of unknown origin, giant cell tumor, aneurysmal bone cyst, and in the malignant group is malignant giant cell tumor and adamantinoma. Then is histiocytic origin, fibrous histiocytoma, benign fibrous histiocytoma, and malignant fibrous histiocytoma. Fibrogenic, metaphyseal fibrous defect, and desmoplastic fibroma, fibrosarcoma. Then is tumors of notochordal region. It is malignant tumor, chordoma. There is no benign counterpart. Then vascular tumors, benign is hemangioma and malignant is hemangioperitocytoma and hemangioendothelioma. Lipogenic, benign is lipoma and malignant is liposarcoma. And then is neurogenic, benign is schwannoma. So that is classification of tumors of the bone. So I repeat this classification. Hematopoietic, 40%, they are malignant myeloma, malignant lymphoma. Cartilage forming tumors, 22%, benign ones, osteochondroma, chondroma, chondroblastoma, chondromyxoid fibroma, and malignant is chondrosarcoma, dedifferentiated chondrosarcoma, mesenchymal chondrosarcoma. Then bone forming tumors. Benign is osteoid osteoma and osteoblastoma. Malignant one is osteosarcoma. Tumors of unknown origin, giant cell tumor, aneurysmal bone cyst, giant cell tumor, malignant one, adamantinoma, then Ewing's sarcoma. Histiocytic region, benign fibrous histiocytoma, and then malignant fibrous histiocytoma. Fibrogenic, metaphyseal fibrous defect, fibroma, desmoplastic fibroma, and fibrosarcoma. Then is the tumor of notochordal region, chordoma. This is a malignant tumor of the bones. Vascular tumors, benign is hemangioma, and malignant is hemangioperitocytoma and hemangioendothelioma. Lipogenic, lipoma, and liposarcoma is malignant. Neurogenic, neurodermatoma, which we also call as schwannoma. So that is about the classification of various tumors. So then is metastasis, metastatic tumors to the bones, like metastasis from prostate, carcinoma, breast, adrenal tumors, and other tumors. So that is about the bone tumors classification. So next time we will discuss the important bone tumors in details, that what is the age group commonly affected, what are the bones commonly affected, what are the clinical features, what are the morphologic features, and what is the complications or diagnostic markers.